Hi, I'm Dr. Sheila Reyes from the Philippines, reporting virtually for Room Now at the ACR 2022. Hydroxychloroquine is a very important drug for lupus because prior studies have already shown its numerous benefits, including decreasing disease flares. Unless absolutely contraindicated, hydroxychloroquine should be given to all patients with lupus. Due to the risk of retinopathy, the 2016 ophthalmology guidelines recommend using hydroxychloroquine at less than or equal to 5 milligram per kilogram of actual body weight, which is equivalent to about less than 400 milligram per day in most patients. But what is the impact of this dose lowering of hydroxychloroquine? In the abstract sessions on Monday, Dr. Jacqueline Nestor will present the results of their study entitled Hydroxychloroquine Dosing Less than 5 milligram per kilogram per day leads to increased hospitalizations for SLE flare with abstract number 1654. The primary objective of the study was to determine the impact of hydroxychloroquine dose on the risk of hospitalizations for SLE flares. So they did a case crossover study within the Mass General Brigham SLE cohort, and they identified patients who were prescribed hydroxychloroquine between January 2011 and December 2021. Patients included were those who were hospitalized for an SLE flare while using hydroxychloroquine, and the exposures of interests were one, average weight-based hydroxychloroquine dose. So this was either less than or equal to 5 mkd or more than 5 mkd, or an average, and an average non-weight-based hydroxychloroquine dose of less than 400 or more than 400 milligrams per day. Basically, they looked into the dose of hydroxychloroquine when SLE patients were hospitalized for a flare. Study results show that low-dose hydroxychloroquine, that's less than 5 mkd for the weight-based dose and less than 400 milligram per day on the non-weight-based dose, were both associated with increased hospitalizations for SLE flares with an adjusted odds ratio of 4.41 and 3.48 respectively. How are these findings relevant to everyday practice? Some limitations of the study that the authors noted were the incomplete information on medication adherence or reasons why patients were on low-dose hydroxychloroquine. This study made me reevaluate whether my patients are indeed receiving adequate doses of hydroxychloroquine. I hope further investigations are carried out to elucidate robust data on this topic, including characterizing the lupus flare in terms of the severity or organ involvement, apart from the limitations mentioned earlier. Hydroxychloroquine is a very important drug for lupus, and issues on retinal toxicity with cumulative doses and is an important factor to consider in dosing. Hence, we need to keep in mind the benefit-risk ratio of giving the drug and, of course, shared decision-making with our patients. Also, regular monitoring of side effects should be included in the equation. So with that, I just throw this question out there. Are your lupus patients receiving optimal doses of hydroxychloroquine? Follow me on Twitter at Rumarampa and tune in to Room Now for more reports and videos of the ACR Convergence 2022. Thank you.